So if you're concerned or you have an interest in perhaps a full mouth rehabilitation, here at BayView Dental, we try to make this process as simple as possible. First starts with a phone call. We make you an appointment. We gather every bit of information that we possibly can regarding if you have insurance, if you don't have insurance, and then we get you in the office to do what we call a workup. The workup entails x-rays, CT scan, panoramic x-ray if necessary, study models, all tools that we need in order to diagnose the situation that you have going on. Again, with you, working together with you, what we call co-diagnosis, determining the best course of action for you. Someone will help you with the financial aspect as well, because we want it to be affordable for you. We don't want you to put yourself in a situation that you're uncomfortable. Once those things in the beginning are agreed to, then it's a simple process of starting the therapy. Generally, depending on what we decide needs to be done, there's potentially a surgical aspect if we're placing implants. There's a crown and bridge prepping aspect if we're going to just crown and bridge. And within the designed period of time, we'll get you to where your smile is exactly what you want. So when you come to BayView Dental with your concerns about potentially a complete smile makeover, we want you to be assured that you'll never walk out of here without having some teeth. There may be a process that takes a number of weeks, perhaps even months. All depends on at the time that you come in, if teeth have to be removed, if we have to do bone grafting, place implants, or if it's just a simple matter of crown and bridge work. But rest assured that the whole process, you'll have a complete understanding. We intend to educate you so you fully understand. When you walk in the door, we want you to expect something to smile about.